What is the cardiopulmonary exercise test? The cardiopulmonary exercise test is a highly sensitive, non-invasive stress test. It is considered a stress test because the exercise stresses your body's systems by making them work faster and harder. A disease or condition that affects the heart, lungs or muscles will limit how much faster and harder these systems can work. A cardiopulmonary exercise test assesses how well the heart, lungs, and muscles are working individually, and how these systems are working in unison. What conditions can be detected and monitored by the cardiopulmonary exercise test? Heart failure. The inability of the heart to pump enough blood to meet the needs of the body's other organs. Myocardial ischemia or heart disease is the reduced blood flow to one or more parts of the heart due to blockage or spasm. Blockage of either the large blood vessels or small blood vessels can be detected by the cardiopulmonary exercise test. Cardiac valve dysfunction. Valves do not open and close properly to contain blood inside the chambers of the heart. Chronotropic incompetence is the inability of the heart to increase the speed of contraction, heart rate, due to medication or intrinsic factors. Heart failure is the inability of the heart to pump enough blood to meet the needs of the body's other organs. Heart, lung, and metabolic conditions may cause shortness of breath, exercise intolerance or discomfort and pain in the chest. The cardiopulmonary exercise test is also used to monitor patients who already have known medical conditions and to determine how a patient is responding to medical treatments. In comparison, traditional treadmill stress tests are generally only used for detection of ischemia, heart disease, macrovascular. The cardiopulmonary exercise test is significantly more accurate in detecting ischemia and can identify many more conditions. How is a cardiopulmonary exercise performed? Unlike a traditional stress test, the cardiopulmonary exercise test is performed on a stationary bicycle, which is safer than a treadmill. Many patients also feel more comfortable riding the bicycle than walking on a treadmill. During the test, various pieces of equipment will be used to monitor your body's response. This equipment includes face mask. This monitors the oxygen used, carbon dioxide produced, and the breathing pattern. The mask is placed over the mouth and nose, similar to an airplane pilot's mask. It does not restrict breathing and you will only be breathing in air from the environment. What is an electrocardiogram (EKG)? 10 stickers will be placed on your chest with monitoring wires attached. This is used to monitor your heart rate and rhythm. Blood pressure cuff. Your blood pressure will be taken multiple times during the test. Pulse oximeter. This is a small device that slides over your finger and uses a light to measure the percentage of blood cells covered with oxygen. How long does the test last? A cardiopulmonary exercise test may take 45 to 60 minutes to complete. The rest, exercise, and recovery lasts for a total of about 15 to 25 minutes, but you will only be exercising at high levels for 3 to 4 of those minutes. The rest of the time will be spent connecting and disconnecting the equipment, completing the health history, and performing the before and after exercise pulmonary tests. How should you prepare for the cardiopulmonary exercise test? Since you will be exercising, be sure to wear comfortable clothing and proper footwear for riding a bicycle. Do not wear a dress, skirt or full slip. You will be wearing EKG leads on your chest, so you should not wear one-piece outfits or clothing that prevents easy access to your chest. Closed-toe shoes are required for testing. Do not wear high heels, sandals or flip-flops. This type of clothing and footwear make pedaling a bicycle quite difficult. Do not eat or drink, except water, for 3 hours before your test. Exercise or physical labor should be avoided for 24 hours before your test. Bring a list of your current medications with you to your test. Your doctor's office will tell you if you are supposed to take your medications before the test, but if you are unsure, contact your doctor. If you have any questions about your test, please contact us at 1-833-855-5777 and ask to speak with the A Pattern Medical Clinic technician. We will answer any questions you might have or direct you to the proper person who can answer your questions. Please call today to set up an appointment.